Hi everyone, I'm Dr. Marc Sklar, the fertility expert, and I am here with one of our other fertility experts, Lonika. And you may have seen her in some of our other videos, and so I'm excited and happy to have her with me. She's going to hopefully be showing her face a little bit more.
Yes.
Today we are here talking about what we are calling stories of hope. And these are stories about our patients, our real patients, how we've worked with them, what we've done with them, and the results we've achieved. And we thought this would be a great way to kind of bring you a little bit closer to what we do and allow you to be able to relate a little bit more to the process itself. So that's how we're going to get started. And it's one of her patients. So Lonika is going to share that with you.
So the patient I want to talk to you about today was one of my patients named Nataly. So she was 34 years old. She was trying to conceive for a couple of years without success and came to me looking for a little bit of extra support and help and kind of figuring out what's going on.
Awesome. And was there any other backstory or medical history that we should know about regarding her before, like aside from the fact that she's trying to get pregnant?
Yeah, so she was actually generally pretty healthy aside from a back injury that she had from a car accident several years prior. And she'd actually had a surgery about 5 years prior to correct that, but was still having some issues with that.
All right. And then when she came in and you were assessing her reproductive health and cycles, what were her cycles like, or did she have any other kind of reproductive issues we should know about?
So the major thing, her cycles were coming pretty regularly at 27 days on the nose. Her major issues with her cycle, she would have severe pain and heavy bleeding with her cycles.
Okay. Something none of us like to have, right?
Not fun.
No. All right. And then aside from coming to us after 2 years of trying, did she reach out to any other professionals as well?
Yes, she actually did go see an OB/GYN who did a little bit of a consult with her. After speaking with her, her major takeaway was that she had endometriosis due to the pain and did not have any letting the dog out, any sort of diagnostics done as far as that goes, and unexplained, and just actually referred her to go see a specialist, a reproductive endocrinologist, to follow up and figure out what was going on.
Sorry for my step away for a moment. So she thought she had endometriosis, but she didn't do any evaluation for that. So the only way to truly evaluate and know if someone has endometriosis is to do a laparoscopy. You've got to go in and see with your eyes if they're there. There are some blood tests or markers that might give a better indication of that now, but in general, the most definitive way is to look inside, and she did not do that. She was just guessing.
Correct.
Okay.
Yeah. So she was pretty disappointed with that and pretty devastated with that.
I'm sure. Yeah. No one wants to be told those diagnoses, especially without any definitive confirmation of it.
Right.
Okay. So when she came in, we did our evaluation, and during that evaluation, you found out what?
So I did a full workup as far as her hormones are concerned. Everything actually looked fairly okay. She did have some slightly elevated estrogen that I really wanted to make sure we worked on, and so that was
a big thing. That's number one.
Yeah, that was actually her major thing that jumped out at me.
Okay.
Yeah.
And then what did you do to address that?
So I should say she also had some inflammation in the body, and so just one of the other things was just helping decrease that inflammation in the body, clear out that estrogen, and help kind of detox her body so we can get those levels back into normalcy. Okay,
so elevated estrogen, increased inflammation or inflammatory markers. So those are the two main things. And then, sorry, you didn't say what you did about that yet.
I did not. Okay. So what I went on to do,
about that?
What I went on to do from there was really just help detox her body and clear out some of that inflammation by doing a fertility detox, helping her get on a really good clean diet and balancing that out. I gave her some supplements to really improve her egg quality, also help decrease that inflammation. We did give her some herbs to regulate the pain and help alleviate some of that, so she was having normal cycles and not having as excessive pain and bleeding.
Okay, awesome. So for those of you who don't know and are learning about detoxes for the first time, something that we utilize often in our practice is the fertility reset detox, because it's really beneficial for kind of, as the name says, resetting our hormones and jumpstarting our fertility. And in this case, she was using it to, one, hopefully lower the inflammatory signs and symptoms and markers, but also to decrease estrogen, right?
Correct.
Awesome.
Yeah.
So she did that. You put her on her supplements, you put her on some Chinese herbs, and then what happened?
Well, she had done her cleanse and detox for about a month or so, and so 1 month following from there, she'd taken her doctor's advice and actually made an appointment with a reproductive endocrinologist or specialist just to get a little bit more testing and get a little bit more of a clear answer.
Okay.
And the week before she had her appointment with the doctor, she emailed me and told me she was pregnant.
Yay, that's awesome.
Yeah, so that was a great,
That's great.
exciting news.
Yeah, that's a wonderful story. So, and how long did it take her from when she started with you till when she got that positive?
It was about 5 to 6 cycles, so about 6 months.
6 months, great. And then that's pretty average. So for everyone watching, I mean, we say somewhere between 3 to 6 months, 3 to 9 months for patients to see those results. So that's pretty average. And then did she maintain some treatment in her pregnancy?
She did, definitely was maintaining treatment, especially in the first trimester, and really to just help support pregnancy in the early stages. And
Awesome.
She delivered a very healthy little girl.
Beautiful.
Yeah.
So Nataly started at 34 years of age with us, but had been trying for 2 years prior. She followed through with everything that Lonica said. She was a good patient.
She was.
And with that, she saw the results in about 6 months, which is awesome. And so we're sharing the story so that you guys can see the potential and the what you can strive for, and know that there is hope for you, even though you've been told potentially that there isn't and that there's no other options. So this is just one of our stories of hope. We'll be sharing more in the future, and hopefully that is helpful and beneficial for you. If you enjoyed this little case study, if you will, then give us a thumbs up. If you want to know when we're producing more of these or any of our other fertility TV episodes, then subscribe to this channel. You can also join the newsletter to get everything straight into your inbox, and you can do that at marksklar.com/newsletter. And then, if you've got any questions about this or comments about the case study, then just leave your comments below or in the blog. All right, everyone, until the next episode.
Bye.
Are you looking for a fertility coach? Are you looking for someone to guide you with your personal needs one-on-one? Well, that can be me. If you want more information on that, check it out right here.